Welcome back. In the time now, 6:24. A lot of people are feeling a void and a loss during this time of staying at home and quarantine, missing those connections with friends, family members, even co-workers. But Dr. Corey Gonzalez is joining us this morning to talk a little bit about what you can do if you are missing those connections, and also why those connections are so important. So even if you feel like you're stuck at home, how you can still reach out. Dr. Gonzalez, good to see you as always. Thanks for joining us.
Good morning, Maddie.
First, talk about how important those connections are. We may not realize what they do for our mental health, but they really make a big difference.
Maddie, I can't, overemphasize how important they are. They're a lifeline for many. I mean, it's a protective measure that helps us buffer through life. It helps with our psychological pain. Actually, the newest research on suicide shows that social connectedness was the biggest remedy for people not to suicide. So it gives us an out. Somebody else cares. It gives us hope. And if you look, we are social beings. If you look at the research, several research on attachment theory, I mean, babies do not, thrive or develop if they don't have that secure connection. You look at the monkeys study by Marlowe. The monkeys did not thrive or develop unless they had that maternal touch. So it's a lifeline for many. It's essential for our mental health.
And a lot of people maybe don't know how to get that connection now that they're stuck at home and they can't do their normal routines.
Well, we've all had to adapt, and I think that's something that's going to come out of this. And I've been doing it myself. I'm no longer at the office, but we need to utilize the social, the video conferencing platforms. These things are essential. The American Psychological Association and the California Psychological Association have really let us know that this is so much more important than talking on the phone or texting or getting emails. That when we see each other, it's a different sense, and it's very important for our connectedness. So we need to get our, these things set up for each other and make time for it, individually, groups, families. And if we have elderly people in our family, people are more vulnerable, with depression or anxiety, and they're isolated, make sure that we get them set up through their iPad or get them hooked in, send them links on their email, have these meetings with them. I know I do with my mom that's aging. We send in and we connect with them, and it's a lifeline for a lot of people, and it's something we need to do.
Do you have ideas, though, for people who don't have that capability, who maybe don't have a device that can do a FaceTime or a Zoom conference or something like that? Maybe all they do have is a telephone.
Well, you can get, the nice thing about these things is you can get these links off your smartphone. So you can actually and you can FaceTime as well, where you can see people. So these things are important, but also we have to get creative. I mean, now's the time that we do need to, we've had to shut down our economy and sort of slow down and be with each other, to make time for each other. I know my wife and I'd have a picnic in the backyard, or, order takeout food from our restaurants to keep them and keep them going, play board games, just things to connect and do and try to find the best out of the situation. Because the reality is that one constant in life, Maddie, is change. Our normal today will not be the normal tomorrow. And we have to embrace these things. And whatever season we're in, we have to embrace and see the best in that and try to find the best approach. Focus on what we can do versus what we can't do, focus on what we have versus what we don't have.
We've talked a lot about maybe adopting some mantras to push out the negative thoughts. So when you notice yourself thinking negative thoughts, maybe to replace it with some positivity. Do you have any ideas of some things that people could use to replace those negative thoughts right now?
Yeah, I mean, there's lots of apps out there that we talked about before that can help with cognitive therapy. We have to pay attention to our thoughts and our distortions of our thoughts. Now, it's okay to acknowledge a loss or something that's negative. We just don't want to get stuck. You acknowledge that loss, and after you acknowledge it, then you move on and you focus on what you can do. So it's important that you don't have to deny things. You have to acknowledge, things are different, or there's been a change, or there's a loss. And by the way, some of the losses people are going through right now are unprecedented and traumatic. If someone goes to the hospital, you can't see them. So it's really difficult, but we need to acknowledge our losses and then, move on and focus on what we can do. We don't want to get stuck in our losses, but we want to reconstruct our thoughts, not just how we feel, but what we think, not overgeneralize. And the good stuff has to count. We have to make sure we focus on what we have and not what we don't have.
All right, Dr. Corey Gonzalez, thanks so much for joining us this morning. As always, sir, we appreciate the tips.
Always a pleasure, Maddie.
We'll be right back.